An editorial published in the Canadian Medical Association journal says that miscarriages affects 1 in 5 pregnancies, but patients seeking help in emergency departments often don't get the best care. One study found a disconnect between the medical view of early pregnancy loss as something that's easily managed and the reality of the patient's own traumatizing experiences. Dr. Catherine Varner, emergency physician deputy editor at the Canadian Medical Association Journal and author of the editorial, joined us to discuss.
So, the care of patients experiencing symptoms of miscarriage, I think, is quite unique to Canada. We know that 4 in 5 patients will seek care in an emergency department, which is very different than places like the US, the UK, or uh, in research out of places like the Netherlands. And so, when patients have symptoms of miscarriage, it often starts with bleeding or pain, and these are the early symptoms, which can be light spotting, and people will try to seek care with a healthcare provider. But when they call their family physician or an 811 number, if they don't have a family physician, they're often told to go to an emergency department, and where they will experience long waits because they're not often the sickest patients in the department, and long waits then for diagnostic imaging. And then, especially in the early days of experiencing symptoms of miscarriage, it may not be clear what's happening even after having an ultrasound. And so patients need follow-up care, but they often don't have follow-up care options in our healthcare system. So then when symptoms start getting worse, they find themselves having to go back to an emergency department to seek care where, again, they have a long wait. They often experience lack of compassionate care in the emergency department, and it's quite difficult for them. So, for over a decade, we've known that other healthcare systems have been doing and this care better than we have in Canada, and patients don't have to seek care in emergency departments. And what places like the UK and the Netherlands offer is streamlined access to early pregnancy specialized care. So patients, when they start having spotting or cramping in first trimester, rather than seeking care in an emergency department, they go directly to an early pregnancy clinic where they can see a nurse, nurse practitioner, a midwife, or a physician who can arrange urgent ultrasonography and blood work that's needed. And then they also provide the ongoing follow-up care. And this is done without a referral. And we know from studies of these settings that the care is better. Patients have much better psychological outcomes as well as physical outcomes, and they're economically, less costly than having to seek care in an emergency department. And this has been something that we've known about, over a decade, that we've called for. The Health Quality Ontario Standards called for this back in 2019. And there's been relatively little traction in this area. There are early pregnancy assessment clinics in some centers in Canada. Most of these are urban centers. Most of them are academically affiliated. But the process to set them up creates a lot of barriers, especially if we are calling for a system whereby patients don't need a referral to these systems.